Good afternoon to everyone and welcome to today's wonderful afternoon with Dr. Murli Bharadwaj. Every Sunday and Thursday we will have a mock test discussion and discuss the most simulating 200 MCQs which appear in the tomorrow's NEETPG exam. Once you give practice of these 30 full-scale mock tests and solve 6,000 MCQs and 60,000 high-yield facts, every mock test is followed by 10 high-yield facts, and that entire thing is given as a hand-scripted, animated, illustrated, mind map, infographic, PDF, like a comic book. So you have 200 pages in each PDF that discuss all the 200 questions. So let's make the great beginning, Doctor. Good to see 8 online classmates and many more who are all attending. So the patient in the radiograph typically is showing a cubitus valgus deformity which lead to the ulnar nerve injury, which lead to the atrophy of the hypothenar muscles is what you need to remember. So all the hypothenar muscles typically are supplied by the ulnar nerve, and you should also know what is the ulnar nerve sensory innervation, claw hand, etc., etc. Phase 2 of the ventricular muscle action potential. There is a plateau. Plateau is due to the opening of the calcium and sodium channels. The L type of calcium channels influx is more than the efflux of the potassium, responsible for the phase 2 of the ventricular muscle action potential is what you need to remember. What is the pattern of the immunofluorescence you are seeing here, doctor? Nuclear speckled discrete pattern, which is typical of systemic sclerosis, which is the common condition asked in the exam. So any abrupt onset of the hypertension with microangiopathic hemolytic anemia with renal failure is the typical pattern of the renal crisis in systemic sclerosis. Interstitial lung disease is the most common type of lung involvement in systemic sclerosis. Raynaud's phenomena, thickening of the skin, internal organ involvement are all the features of the systemic sclerosis. Anything about it, you need to be doubly sure for the tomorrow's exam. Can the online students can punch? Is the voice loud and clear for all of you, doctor? Please punch. Is the voice is loud and clear for all of you? Hello? Keep posting. Some more. Yeah. Thank you, Bora, for giving the feedback that the voice is loud and clear. Nice to see. Neat voyage and many more. Thank you. Yeah. Glomerulopathy, which is typically focal segmental glomerulosclerosis of the collapsing variant, is a typical feature which you see in case of HIV. Nephropathy is what you need to basically remember. This histological appearance where you have the clear cell carcinoma is a feature of the renal cell carcinoma. So every MCQ in the mock test, you should be ready with around 10 points. That is the beauty of the visual imagery that gives you the greater memory than any of these online classes, face-to-face classes, video lecture apps. It is this 200 pages PDF that I send you as explanatory answer containing 2000 high yield facts. All the 30 mock tests into 200, 6,000 MCQs, 60,000 high yield facts you get in this format. Just focus on this and go to the NEETPG. 100% strike rate and you are sure to become the topper. There are toppers who became toppers only by attending mock tests with Dr. Murli Bharadwaj. So now, doctor, a child with this phenotype. So what do you see here? There is a sandal gap between the big toe and the second toe, which is typical of Down syndrome. And in the Down syndrome, what you see is a hypothyroidism, not hyper. But Down has Christian disease, leukemia, sensorineural hearing loss, association with all of these is what you have to remember. A farmer with productive cough, bronchoalveolar lavage has been shown typically, which is showing septate hyphae, which is classical of aspergillosis. And what is the treatment of aspergilloma, doctor? Oriconazole or itraconazole is what you have to basically remember. Whenever the disease becomes severe, that is the time where amphotericin B lipid formulation is the one which is preferred. And what is the side effect of ketoconazole? All patients on ketoconazole, you need to check for the LFT because hepatotoxicity is the classical feature. 67-year-old is being admitted for emergency with chronic productive cough and green sputum with pneumonia. So, in CURB 65 score, based on all this, what is the score? The score is 4. Maximum score is 5. 3 to 5 is high risk and very severe. And most common X-ray finding is lobar consolidation is what you need to remember. 65-year-old with the sputum and cough, 15-day fever. What is this organism? It is a Legionella pneumophila, inhalation of the aerosolized water droplets, contaminated water systems, like cooling towers, AC, showers, fountains, classical feature. You ask to interpret an AVG. Whenever there is hypoxia with a normocapnia, CO2 is normal, low oxygen, you think of type 1 respiratory failure is what you need to remember. In this, you are seeing a right-sided pleural effusion, which typically will show reduced air entry, dullness on percussion, classical features of pleural effusion. 45-year-old, typically the protein content is more than 30 grams. So what is light criteria? The light criteria says the protein ratio between the protein and serum more than 0.5. LDH ratio where pleural to serum is more than 0.6. Pleural LDH, 2/3 upper limit of the serum LDH, typical of an exudative effusion, which is commonly seen in case of TB, pneumonia, malignancy, connective tissue disorders, and pancreatitis is what you need to remember. Now this patient, acute onset of shortness of breath. What do you see here, doctor? You are seeing lead 1, after R wave, there is an S wave, S1. Q3, before the R wave, there is a negative wave, Q3 in the lead 3. T wave inversion is there, S1, Q3, T3 is the feature of pulmonary embolism. CT, pulmonary angiogram, is considered to be the investigation of choice. So what is the appropriate first-line treatment for the management of the asthma? SABAs, short-acting beta-2 agonists. So it's called stepwise approach in asthma is what you need to remember. 46-year-old with shortness of breath. What is the classical pattern, doctor? S1, Q3, T3. You should not forget. But most common finding is not S1, Q3, T3. It is the sinus tachycardia, which is the most common finding, is what you have to remember. 67-year-old, COPD with hyperinflation. So whenever COPD is there, person is hyperventilating, he has got respiratory alkalosis, so pH is equal to 7.44 and a low PCO2, which is classical of respiratory alkalosis is the COPD ABG pattern. Increased pH, increased PCO2, increased bicarb, decreased PCO2 and decreased O2 is the combination. Now, 3-month history of mucopurulent discharge, carcinogenous syndrome, cystic fibrosis, pneumonia, anything can lead to the development of the bronchiectasis with a honeycombing pattern is very, very classical. Now, a 15-year-old boy, his X-ray has been shown, which is showing spiral fracture, which is typically seen in case of torsional force. A 13-year-old boy who has got torsal coagulation, it's called the C sign, where the talar beak is seen because of the talocalcaneal fusion is a congenital anomaly is what you need to basically remember. Talocalcaneal coalition. CT scan is the gold standard, typically presents at 8 to 16 years of age. Now, a 50-year-old diabetic patient showing Dupuytren's contracture, which is typically seen in diabetes, alcohol, smoking, you need to do an operative release with local anesthetic is what we need to remember. So I leave you 10 points to remember about the Dupuytren's contracture. Now, a 22-year-old football player sustained an injury. Suddenly the leg got twisted. So what do you expect, doctor? The most likely possibility is a anterior cruciate ligament injury. There will be an effusion, medial joint tenderness, positive Lachman's test. They're all the classical features which you need to remember. A 31-year-old woman is brought to emergency. So typically she is having the fracture which is mid-shaft of the humerus, radial nerve injury leading to the development of the wrist drop is what we need to remember. A 62-year-old man who is having a mass lesion, which is hypo-enhancing mass lesion in the head of the pancreas, which is causing the obstruction of the pancreatic head. So, resectable periampullary pancreatic head cancer, which need to be treated with pancreaticoduodenectomy, Whipple surgery is what you need to basically remember. So, what is the most important resectability criteria? No involvement of the superior mesenteric artery is essential to call pancreatic cancer as resectable tumor is what we need to remember. 37-year-old, 3 days of increasing epigastric pain. Gallbladder is showing the thickening and echogenic foci which are suggestive of the cholelithiasis. So you need to do an upper abdominal ultrasound scan is considered to be the investigation of choice. Always gallstones, you should think. The investigation of choice is ultrasound. 60-year-old has epigastric pain with jaundice, with pale stools, with dark urine. So ultrasound shows dilated bile duct with intraductal stone which is causing obstruction. Magnetic resonance, cholangio, pancreatography is the gold standard investigation is what we need to basically remember. So, best non-invasive test. 72-year-old woman, recent ultrasound is demonstrating the gallstones in the gallbladder and a probable stone in the common bile duct. So, ERCP is showing a filling defect in the CBD causing obstruction. Sphincterotomy is considered to be the treatment of choice, which you need to understand. A 79-year-old has intermittent episodes of the colicky epigastric pain. Abdominal X-ray has been shown. Typically, there are multiple air fluid levels, which is characteristic feature of the small bowel obstruction is what you need to basically remember. Right, doctor? Now, a patient is due to undergo the investigation 4th time. He is being kept in diet to make visualization better, but the patient did not follow the instruction. So generally, whenever you do ultrasound, any food is a impediment for visualization. You need to be very sure about. A patient with dysphagia, unsafe swallow reflex following a stroke. So we need to put PEC tube, percutaneous endoscopic gastrostomy tube, for the long-term enteral feeding is what we need to remember. 37-year-old with a worsening of the epigastric pain, weight loss, and loose stools despite acid reduction treatment. So multiple refractory peptic ulcers must make you to think of Zollinger-Ellison syndrome, which is gastrinoma, is what we need to remember. So basal acid output is increased fasting gastrin and pH less than 2 is the most important test to prove it. Secretin stimulation test where gastrin is more than 120 picogram per ml. Instead of secretin suppressing, there is a paradoxical increase in gastrin, which is an important indication that patient is having gastrinoma, is what we need to remember. A 7-year-old child, defective T lymphocyte maturation due to congenital absence of thymus is what you need to remember. So absent thymus, decreased T cells, recurrent infections, very important thing to remember. A 12-year-old boy with short stature, X-ray of long bone shows an open epiphyseal growth plate composed of hyaline cartilage. So which joint is represented by epiphyseal plate? Doctor, it is synchondrosis. Once more you should know, hyaline, elastic, fibro, 3 types of cartilage. So the glassy appearance with type 2 collagen, one of the favorite questions of the examiner is hyaline cartilage. So which artery is palpated posterior to medial malleolus, doctor? Posterior tibial artery. So compression of which nerve can happen with aortic artery aneurysm? It is the left recurrent laryngeal nerve. You need to remember, right recurrent laryngeal nerve loops under right subclavian, left loops under aortic arch is what we have to remember. In the anterior interventricular groove, along with the left anterior descending artery, which vein is found? Great cardiac vein is the one which is being found, is what we need to remember. Once more, coronary circulation. What are the arteries, veins draining the heart is the favorite question every NEETPG exam. 10-year-old cartogenous syndrome. Dynein, kinesin are primarily responsible for the movement of vesicles and organelles along microtubules. So dynein to end, to negative end, retrograde transport. Kinesin to positive end, that is anterograde transport. Across microtubule is what you have to remember. So all these chota mota funda, you need to be very sure, doctor, when you go to the NEETPG exam tomorrow. Very nice to see 7 online classmates every Thursday, every Sunday. हम मिलेंगे और totally 30 full scale mock test को end to end discuss करेंगे. 6,000 MCQ, 60,000 high yield facts, 100% strike rate in the tomorrow's NEETPG exam. Promise me you are with me until August 30. Every Thursday and Sunday. I'll send you, when you enroll, I send you 30 PDFs, each PDF containing 200 MCQs ka pictorial, picnomic, infographic, mind map, color sketched illustrations for you. Like a comic book, you do the revision of your full-scale grand test. So we are now into the disruption of the way we are teaching for the past 26 years with the modern tools available to do better teaching. 19-year-old develops hyperthermia, muscle rigidity, tachycardia. What is your diagnosis, doctor? Malignant hyperthermia. It is the ryanodine receptors, L-type calcium channels in the T tubules which are abnormal. So ryanodine RYR1 mutation is the one which is the genetic defect. Defect is that the L-type calcium channel in the T tubules is what you should remember. 65-year-old with congestive heart failure started on digoxin therapy. Digoxin inhibits sodium potassium ADPase. So sodium potassium ADPase uses ATP. It will extrude 3 sodium out of the cell in exchange to 2 potassium into the cell is what you need to remember. A 32-year-old sustains a deep puncture injury in the sole of the foot. So which sensory receptors typically are high frequency vibration receptors, Pacinian corpuscles. So Merkel's disc, roughness, free nerve endings. Which receptor does what? Favorite question of the examiner, sensory receptors, don't miss that. 58-year-old with severe hemorrhage develops hypotension. Sympathetic stimulation increases the renin secretion. It acts on which receptor? It is the beta-1 adrenergic receptors, which are typically present on the juxtaglomerular cells on which it acts. Once more, Dr. Renin-angiotensin system in physiology is a favorite question of the examiner. 6-year-old with chronic constipation is prescribed lactulose syrup. What is lactulose? It is a disaccharide of galactose and fructose is what you need to basically remember. Now, intracellular killing by macrophages is typically done in the lysosome with the lysosomal enzymes is what you need to remember. Now, for ketone body synthesis, 2-acetyl-CoA combine to form aceto-acetyl-CoA, which becomes HMG-CoA, which become acetoacetate, which become acetone and beta-hydroxybutyrate. So, it is the HMG-CoA synthase which does the condensation of aceto-acetyl-CoA molecule into HMG-CoA is what you need to remember. Now, please try to not confuse between HMG-CoA synthase, reductase. They are different. Favorite question of the examiner. Statins act on what? Ketone bodies के लिए क्या चाहिए? सब कुछ you need to be very sure. Very fine difference. A 45-year-old with diabetes, obese man. So fatty acid synthesis में first time क्या तैयार होगा? 16 carbon. Palmitic acid is the end product, 16 carbon palmitic acid. So you should know fatty acid synthesis. Acetyl-CoA become malonyl-CoA, 2 carbon to 3 carbon. Then malonyl-CoA ultimately will become palmitic acid is what we have to basically remember. 3-month-old infant with recurrent severe bacterial, viral, fungal infections. So typically ATP become AMP, become adenosine, become inosine and deoxyadenosine. ADA deficiency there is an increased deoxyadenosine and deoxy-ATP, which is toxic to lymphocytes. There is a loss of both the T lymphocyte and the B lymphocyte whenever there is any severe combined immunodeficiency because of the adenosine deaminase deficiency is what we have to remember. 6-year-old with acute diarrhea with E. coli. E. coli, the gram-negative organism, typically is identified on McConkey agar. Lactose fermenters like E. coli, Klebsiella, Enterobacter form pink-red colonies. Whereas Salmonella, Shigella, Proteus, they are all the lactose non-fermenters form the colorless colonies on the McConkey agar is what you need to remember. A throat swab collected from the patient with suspected diarrhea. What is the transport medium for Corynebacterium? Stewart transport medium. Stewart में क्या होगा? Stewart में charcoal होगा. Charcoal kaiku होगा. ये सब चीजें I leave you in the infographic PDF. Every mock test that I send you for you to remember. 7-year-old with fever, sore throat, difficulty swallowing, bull neck appearance, corynebacterium diphtheriae. Groove sign typically in the case of the lymphogranuloma, venereum. Presence of chicken pox in childhood reactivates in adulthood to form the typical herpes zoster, varicella zoster virus. You should remember. Now, what type of antagonism is being presented where there is a rightward shift with the Emax unchanged? It is typically competitive antagonism. Competitive, non-competitive, physiological, chemical, different types of antagonism with examples which will affect the potency, Emax, everything. You need to be ready for the examiner. Exam hall में आप ताज्जुब नहीं होना, सरप्राइज नहीं होना, शॉक में नहीं जाना. Beforehand only, take 30 full-scale grand tests with Dr. Murli Bharadwaj. Seat guarantee, because you know what examiner is going to put in the buffet of 200 MCQs in the exam hall. And I am the one who will provide that. The practice to fight with the examiner. 26-year-old develops headache, nausea, giddiness. We give acetazolamide to treat the mountain sickness. How does acetazolamide act? Acetazolamide is a carbonic anhydrase inhibitor. It will cause the bicarbonatenuria. Once bicarbonate is lost into urine, patient develops acidosis. To compensate metabolic acidosis, he will go into respiratory alkalosis by hyperventilating. Increased ventilation will cause increased oxygen intake, which treats the mountain sickness. That is the funda behind giving carbonic anhydrase, to create artificially metabolic acidosis by inducing the bicarbonatenuria, is what you need to basically remember. 19-year-old with bronchial asthma frequently uses inhaled beta-2 agonists for symptomatic relief. So salbutamol-like drugs, they develop tachyphylaxis. Patients regularly take salbutamol. If you regularly take, it is like you lose sensation about giving a kiss if you are constantly kissing. So you need to give breaks. So also salbutamol. Now, 24-year-old with schizophrenia, typically which antipsychotic can lead to hyperprolactinemia? It is the risperidone. Risperidone has a very high risk, whereas clozapine, olanzapine, quetiapine, aripiprazole have got a low risk, is what you need to remember. 52-year-old with multi-drug resistant TB develops bilateral hearing loss, high frequency, which is typical of aminoglycosides. Kanamycin is what you need to remember. 35-year-old with chronic cervical lymphadenopathy with caseating granuloma. Normal serum calcium levels. What is the calcification called? It's called dystrophic calcification into degenerative tissues. You need to know everything about types of calcification. So the cellular adaptation which is being shown due to disuse is atrophy. 48-year-old, which pathological process do you see, doctor, with pleomorphism, hyperchromasia, increased mitosis with loss of polarity? It is the dysplasia, is what we need to remember. Whenever hypersegmented neutrophils are there, you will think of only megaloblastic anemia, macrocytic megaloblastic anemia. 60-year-old, chest pain, MI. What is the first change to happen in myocardial infarction? Stretching and waviness of muscle fibers. So you need to know waviness of fiber 0 to 4 hours, contraction bands 4 to 12 hours, coagulative necrosis 12 to 24 hours, neutrophilic migration 1 to 3 days, macrophages 3 to 7 days, granulation tissue more than 7 days. Oh my God. Who said cracking NEETPG require brains? It does not require brain, doctor. It requires spinal cord and cardia equina. 42-year-old medico-legal autopsy for the preservation of the blood samples, typically sodium fluoride it prevents clotting, it prevents glycolysis, is what you need to remember. It is an aconitase among the glycolytic enzymes, which is inhibited by the sodium fluoride. So that is the reason we add that as a preservative. Where the blood samples are there. Bharatiya Natya Samhita. A 28-year-old woman is convicted under section 64(1). What are the minimum terms of rigorous imprisonment under this? 10 years. Nyaya Samhita, not Natya Samhita, Nyaya Samhita. Okay. Right. So, minimum rigorous imprisonment for rape is 10 years is what you need to remember. A 25-year-old motorcyclist sustains a superficial injury after skidding on a rough road surface. There is a linear abrasion causing tangential scraping of the skin against the ground. It is called the graze abrasion, is what you need to remember. So what is graze abrasion, pressure abrasion, imprint abrasion, scratch abrasion? Oh my God, abrasionology in forensic medicine, favorite question of the examiner. A forensic expert is performing hydrostatic pressure. For you to understand this, one simple funda. Respired lungs float. Specific gravity is less than 1.00. Unrespired lungs will sink. That is specific gravity 1.04. Simple. Hydrostatic pressure ka funda kya hai? Acha figura, illustrations, mnemonics, picnomics, माइंड मैप्स डाल के आपको अमर चित्र कथा के जैसे कॉमिक बुक दे रहे हैं. Comical way you try to prepare for the NEETPG exam. Always visual memory is the best doctor. If you don't visualize, any number of videos you see, any number of audios you listen, any number of face-to-face classes you go, unless your brain internalizes what is there, then only you can be able to present it in the exam hall. I want to tell you once more. 35-year-old with chronic suppurative otitis media. What is the shortest distance between tympanic membrane and the promontory of the mesotympanum? It is 2 millimeters. 2 millimeters. 32-year-old with tinnitus. Otoscopy is normal. Audiometry show fixation of the stapes foot plate due to otosclerosis. We do tympanotomy with stapedectomy. You need to be very sure what is the treatment modalities in case of the otosclerosis. Right? There is a conductive hearing loss with air-bone gap. Rennie is negative where bone conduction is more than air conduction in otosclerosis. There is a lateralization of the Weber in otosclerosis towards the affected ear is what you need to remember. There is a swishing tinnitus. Right? Earliest and characteristic symptom of glomus tympanicum is tinnitus. A 15-year-old with recurrent episodes of profuse epistaxis and progressive nasal obstruction. Nasopharyngeal angiofibroma. So, reddish lobulated mass in the nasopharynx, which bleeds on touch. So, it is a highly vascular tuba. The major feed comes from the maxillary arteries, phenolpalatine branch. Common in adolescent males, and surgical excision is considered to be the treatment of choice, is what you need to remember. Micluk cells, Russell's bodies equal to rhinoscleroma. 35-year-old professional trumpet player typically develops a air-filled dilatation of the laryngeal saccule, which is called the typical laryngocele, is what you need to remember. A 3-month-old omega-shaped vocal cords, glottis, typically is laryngomalacia. 23-year-old worries there are some secret messages transmitted to him through the television. No depression, no mania. Third person hallucinations are there. It is typically schizophrenia. So you need to know, of all auditory hallucinations are the most common type of the hallucinations. Delusions, hallucinations, disorganized behavior is equal to schizophrenia, is what you need to remember. A 29-year-old presents to the emergency with sudden onset of intense fear with palpitations, sweating, chest tightness, tremors, and feeling of impending doom is panic attack. Restlessness, muscle tension, irritability, and difficulty sleeping is generalized anxiety disorder. So, according to the Sherrington's law, for the right superior oblique during the gaze, it is the left inferior rectus which is considered to be the yoke muscle is what you need to remember. So what is Sherrington's law? What is the action of all these extraocular muscles? What are the yoke muscles? Everything. And what is Bilskowski's head tilt test? I leave the literature to you in the PDF number because we need to discuss 200 MCQs in a quick 1.5 hour 90 मिनट्स में खत्म करना ताकि हमारे समझ में आना कि भाई कितने क्वेश्चंस मुझे मैं आंसर कर पा रहा हूं कितने नहीं कर पा रहा हूं what are the areas that I need to improve everything you need to do self analysis. That's how the mock tests are meant for. 14-year-old corneal epithelial defect shield ulcer is the keyword. Vernal keratoconjunctivitis, where shield ulcer along the superior cornea, giant papillae in the upper tarsal conjunctiva is the classical feature. 48-year-old with axial myopathy. Typically, chorioretinal degeneration is an important risk factor with retinal detachment as a possible complication in case of the myopia, pathological myopia. There is a chorioretinal atrophy where there is a degeneration of the retinal pigment epithelium is what we need to remember. Firm nodular lesion arising from the meibomian gland. You need to think of sebaceous cell carcinoma. Whenever there is any trauma, we get the rosette cataract is the characteristic feature, right? So you need to know which type of cataracts, where are they found. So, timolol is a beta blocker, which is not good when our patient is having bronchial asthma. A 28-year-old pedestrian is being stuck directly on the leg by moving vehicle bumper. So, it's called bumper's fracture, where there is a fracture of the tibia and fibula at the same level is what you need to remember. So, you need to be very sure to recognize the X-ray in the exam. So whenever the 3-point relation between medial epicondyle, lateral epicondyle and olecranon, if it is being displaced, altered, that means there is a elbow fracture which is involving the olecranon. Whereas in supracondylar fracture of the humerus, which is the closest differential diagnosis, the 3-point relationship is absolutely maintained is what you need to remember. So olecranon fracture happens by whoosh, falling on outstretched hand is what you need to remember. 34-year-old woman. Physician asked to flex the thumb into the palm and ulnar deviate the wrist, which reproduces the pain over the distal radius. What is that condition, doctor? D. Quervain stenosynovitis is what you need to remember. So, inflammation of the tendons in the first dorsal component, abductor pollicis longus and extensor pollicis brevis is the typical feature in case of D. Quervain stenosynovitis. Typically, the patient has hip dislocation. Lower limb is abducted, externally rotated, slightly flexed at the hip. The femoral head is palpable in the groin region is a case of anterior hip dislocation is what you need to remember. There is a cartilage-capped bony outgrowth arising from the metaphysis of the long bone, which is typical of osteochondroma. Most common in adolescents, young adults, around the knee is what you need to remember. So, typically when ulnar nerve injury is there at the elbow, there is a claw finger deformity where MCP is in hyperextension, IP is in flexion. That's very typical. A 6-year-old is being brought with recurrent fractures following trivial trauma. Osteogenesis imperfecta. Codfish vertebrae is the characteristic feature of osteoporosis. In cystic fibrosis, it is the chloride channels. CFTR chloride channel open, whereas CFTR chloride channel is defective in case of cystic fibrosis. 3 Hz and spike is absent seizures, and valproate is considered to be the treatment of choice, and increased gamma, blocking of sodium channels, decreased T-type calcium channels is the mechanism of action of the valproate is what you need to remember. Whenever 38-year-old pregnant women, advanced mental age is there, it is a risk factor for the Down syndrome. In Kawasaki disease, the first line therapy is not the steroid, it is the aspirin. So bilateral non-purulent conjunctivitis, strawberry tongue, cracked lips, cervical lymphadenopathy, desquamation of the palms and soles, and fever more than 5 days. The criteria to call Kawasaki disease must be there in your tips when you go to the NEETPG exam, doctor. A 2-year-old is being brought to emergency after accidental ingestion of the multiple iron tablets. Iron ka antidote is deferoxamine. Respiratory syncytial virus associated bronchiolitis is the most common cause for wheezing, tachypnea, difficulty feeding during the winter. Global hunger index में क्या क्या है? Undernourishment, child wasting, child stunting, they're all the part of the global hunger index. Early diagnosis and treatment is called as secondary prevention, which you need to remember. So, any improved survival, prolonged duration of the illness will decrease the incidence but increase the prevalence. Prevalence is old plus new cases. So, whenever the bat drops, it is a Nipah virus. Bats plus date palm soup is equal to Nipah virus. Now, according to the antenatal care recommendations, first antenatal checkup should ideally be completed by 12 to 14 weeks is what we need to remember. So, belief-based misconceptions rooted in the community. What is that called? Cultural barrier. Vaccines cause, if my child give vaccine, he will develop impotence, infertility. That is all what? Community-based cultural barriers. 12-year-old boy with exertional fatigue and headache typically is coarctation of aorta, where there is an increased BP in the upper limbs and a decreased BP in the lower limbs is what you need to remember. Whenever acute rheumatic fever is there, we give aspirin in order to treat it. So arthritis, carditis, chorea is the typical presentation. 60 to 100 milligram per kg per day in 4 to 5 divided doses of aspirin need to be given. So imagine, doctor, if somebody is about 50 kgs into 60 mg, 3000 mg देना पड़ता एस्पिरिन को. इतना एस्पिरिन देना पड़ता आर्थराइटिस में. छोटा मोटा 75 mg, 125 mg नहीं है. So that is what we need to remember. Pulsus paradoxus, rise of the JVP during inspiration, Kusumal sign, classical of constrictive pericarditis. So, non-shockable cardiac arrest rhythm, which require adrenaline administration, is asystole, flatline. Now, 72-year-old has giddiness, blurring of the vision immediately after standing. So, what is the definition of orthostatic hypotension, doctor? Any decrease in the BP by 20 millimeters of mercury within 3 minutes of standing defines orthostatic hypotension. Tall tented T waves is the typical ECG pattern that you see in case of the hyperkalemia. Muffled heart sounds is a feature of the cardiac tamponade. Aortic regurgitation, aortic dissection. They are all the features which are predisposed by Marfan syndrome. Diplegia is both legs and arms are typically more pronounced in the legs than the arms. All four limbs are involved. That is called diplegia. All four limbs equally involved is quadriplegia. Then there is a neck stiffness, India ink staining. Think of Cryptococcus neoformans. Family history of similar neurological disorder with the chorea and cognitive decline is equal to Huntington's disease, 4P, CAG repeat, cytosine adenine guanine, trinucleotide repeat disorder, phenomenon of anticipation. That is, the disease become more severe as the generations pass down, is called Huntington's chorea. 28-year-old with ascending paralysis after acute gastroenteritis is post-infectious demyelinating polyneuritis, which is called the Guillain-Barré syndrome. You need to know the differential diagnosis and how to differentiate. 60-year-old, elevated BP with 220 by 130. You want to decrease rapidly, lower the BP. IV nitroprusside is considered to be the best way to treat hypertensive emergencies. 55-year-old, agitation, global confusion, disorientation, hallucination, fever, and autonomic hyperactivity is equal to delirium tremens, which is a very severe form of withdrawal, is what you need to remember. It takes 48 to 96 hours. After the cessation, typically delirium tremens will occur. So whenever fasciculations is there, areflexia, that is equivalent to lower motor neuron, which is typically seen whenever peripheral ganglia are involved, flaccid paralysis. Spontaneous intracerebral hemorrhage, most common site is the putamen, is what you need to remember. Carcinoid tumor, most commonly, classically, flushing, diarrhea, wheezing, tricuspid regurgitation. They're all the features when bronchial carcinoid is present. So, painful erythematous rash, intertriginous rash, diabetes, weight loss, necrolytic migratory erythema is the typical feature which you see in case of the glucagonoma. Elevated alkaline phosphatase with a low serum calcium and phosphate. The combination is typically seen in case of vitamin D deficiency. Now, whenever long-standing diabetes is there, diabetes can lead to autonomic neuropathy, peripheral neuropathy, sensory motor neuropathy, sensory neuropathy in the stalk and glove distribution, with large fiber involvement affecting the vibration, sensory polyneuropathy classically. A 10-year-old child, low hemoglobin, elevated unconjugated bilirubin, acute onset of the hand and foot pain, which is called dactylitis, is the feature of the sickle cell crisis. Prolonged PTAPTT with thrombocytopenia is the feature in disseminated intravascular coagulation. Philadelphia chromosome is translocation between chromosome 9 and long arm of the chromosome 22. Gastrointestinal neuroendocrine tumor is very common in the ileum, is what you need to remember. Traveler's diarrhea most commonly is because of the Campylobacter. Acute hepatitis with elevated aminotransferases with the high risk of chronic infection is the feature of hepatitis C. The most common cause of chronic hepatitis worldwide is hepatitis C. Big toe arthritis, along with negatively birefringent needle-shaped crystals, is equivalent to the gouty arthritis. Inside the calotropes triangle, you are having the cystic artery. So what are the boundaries? Cystic duct lateral, common hepatic duct medial, inferior surface of the liver superior. You should not forget the calotropes triangle, so many times asked in the exam. So, right iliac fossa with fever and vomiting, you should think of McBurney's point. 1/3 from anterior superior iliac spine to umbilicus at the junction of the lateral 1/3 and medial 2/3. So you should know what is Lange point, Murphy point, Rossing point, obturator sign, Sobas sign, everything. I leave the literature for you to remember. A 3-day-old neonate with bilious vomiting, with abdominal distension, irritability, with multiple dilated gas-filled bowel loops. You will think of intestinal malrotation, where there's a bilious vomiting, abdominal distension, irritability is what you need to remember, doctor. So whenever there are multiple colonic polyps with mandibular osteomas, with abdominal wall desmoid tumor, you will think of Gardner's syndrome. 65-year-old, multiple air fluid levels with the bowel wall gas collection, which is indicative of pneumatosis intestinalis. 40-year-old, intermittent discharge from the external opening with minimal pain. Abnormal tract between anal canal and perianal skin is fistula in ano. You need to know what is the Kutzall's rule. The most common cause is cryptoglandular infection of the anal glands, is what we need to remember. Orphan annii nuclei, classical of papillary carcinoma of the thyroid. So which type of hernia passes along the path of the spermatocord, doctor? Indirect inguinal hernia. So direct is medial to inferior epigastric vessels, whereas indirect is lateral to inferior epigastric vessels. Hazelback's triangle anatomy, everything you need to be ready and remember for the tomorrow's exam. So if you go to the NEETPG exam, doctor, always, when you go to the NEETPG exam, 200 questions are standard, like a buffet. There is no surprise. You can expect it, go and attack it. Simple, right? So, 60-year-old with renal mass, 8 centimeters on the right kidney, what is the surgical treatment? Total radical nephrectomy is considered to be the management. So, smoking, obesity, hypertension are the risk factors. Hematuria, flank pain, and mass is the presentation. Any mass more than 7 centimeters require radical nephrectomy. You need to know the protocol. A 26-year-old man presents with painless enlargement of the right testis. So what is the best investigation in a suspected testicular mass, doctor? It is the scrotal ultrasonography, painless enlargement of the right testis. The urethral opening is located on the ventral surface of the penis with a ventral curvature, which is called chordae, is a feature of hypospadias. Now, there is a tender hepatomegaly, liver abscess, most sensitive testis. Always contrast enhanced CT is the best investigation. Whenever upper esophagus में chicken bone फंस गए तो it is the rigid, not flexible, rigid endoscopic extraction that need to be done. So, thermal ablation is the gold standard treatment for the treatment of the varicose veins. In filarial infection, it is a progressive non-pitting edema of the both feet in endemic areas is filariasis, and lymphatics are the ones which are involved. Whenever patient is unstable with hemoperitoneum in a road traffic accident, the best way to treat is to do the exploratory laparotomy is considered to be the treatment of choice. In hypovolemic shock, for the resuscitation, the first fluid in hypovolemic shock is normal saline. It is rapid expansion of the intravascular volume. For the burns, liver disease, metabolic acidosis, ringer lactate, balanced crystalloid, it contains the lactate is the one which is preferred in burns, liver disease, and metabolic acidosis. Now, whenever there is a finger injury, then entire epidermis plus entire dermis, full thickness skin graft is the one which is basically preferred. So once more, the types of graft, where do you do? So best areas for which need better color, texture and minimal contraction, we do the full thickness skin graft. 25-year-old with head injury, with a biconvex shaped opacity is epidural hemorrhage is what we need to remember. So in acute appendicitis, we do gridiron incision, McBurney's. There is a midline incision, there's a Kocher's incision, Fenelstein's incision. You need to be doubly sure about all these various incisions. 52-year-old, long-standing chronic liver disease, portal hypertension, typically has got esophageal variceal bleeding. Reducible on lying down, periumbilical, characteristically is paraumbilical hernia. Then dysphagia lusoria is an aberrant right subclavian artery involvement. Acute pancreatitis may. Early initiation of enteral feeding will improve the prognosis. Multiple studies say the early you initiate enteral feeding, the better it is. 28-year-old with thick homogeneous grayish white vaginal discharge. Fischiador, bacterial vaginosis. Chlamydia trachomatis is commonly present in urethra. So whenever suspected endometriosis, then laparoscopy is considered to be the gold standard. Whenever CA 125 levels are elevated to 60, you will think of malignant ovarian tumor. Karyotyping is 46XX of paternal origin, no fetal parts, pronounced hydropic degeneration, grape-like villi. You will think of complete hydatiform mole. So foul-smelling discharge whenever it is there, mild spotting is very common after IUCD insertion. Only what she requires is a little reassurance. It will settle down spontaneously. Snowstorm appearance, hydatiform mole. So cervical fibroids, they are only 1% of all fibroids. There is a single fibroid which is encountered inside the cervix. So submucosal, intramural, cervical, parasitic, different types. Cervical fibroid is only 1% of all fibroids. Headaches and visual disturbances. You will think of pituitary adenoma. Secondary amenorrhea, galactorrhea, headache, visual disturbance, they are all the classical features. Webbed neck, widely spaced nipples, cubitus valgus, Turner syndrome, but actually answer is wrong. No mental retardation, right? No mental retardation. So they have a normal mentation. Actually, question need a small correction. Low postural hairline, micrognathia, lymphedema, renal anomalies, they are all the associated features. Most common is coarctation of aorta in the cardiac association. But Turner have normal mentation, normal, no mental retardation. Tamoxifen is antagonist at the level of the breast, but agonist at the level of endometrium. That's the reason tamoxifen therapy, whenever you give, there is a risk for endometrial carcinoma. Now, inhibin B is secreted by granulosa cells. It basically inhibits the follicle stimulating hormone secretion from the anterior pituitary. Similarly, subtly cells in the male testis also produce activin, inhibin, and androgen binding protein, 3 things. 24-year-old sustained high levels of estradiol for about 48 hours. Before 48 hours will stimulate the mid-cycle LH surge is what you need to remember. So you should know all types of conjugates. True conjugate is the shortest distance between sacral, promontory and upper border of the pubic symphysis. True conjugate is 11 to 12.5 centimeters. Obstetric conjugate is 10.5 to 11. Diagonal is 12.5 to 30. So all these values, definitions, favorite question of the examiner doctor. We'll take a quick voice break and join back. Just stay back, be online. 5 minutes, I'll join back. Can you on it? Manu? Can you on it? Battery? So, welcome back to the session, doctor. 30-year-old primigravida in second trimester. Despite a rise in the cardiac output, her blood pressure is reduced. Why? Because in pregnancy, the rise of the progesterone relaxes the smooth muscle in the blood vessel, and that vasodilatation decreases the systemic vascular resistance, and that can lead to the development of a fall of the diastolic pressure, is what you need to remember. Now, in the embryonic life, which fetal vascular structure bypasses the liver? So from the placenta, the blood will pass through ductus venosus before joining the IVC and bypassing the liver, because liver is not yet mature in the embryonic life. Now, implantation of the blastocysts typically occur by 5th to 6th day is what we need to remember. How many lobes are there in placenta, doc? 10 to 38 lobes are there in the placenta. Now, which is not a contraindication for vaginal birth after cesarean. Preeclampsia is not a contraindication. Previous classical cesarean, inverted T-shaped uterine incision, previous uterine rupture, they are all the contraindications. Now, 30-year-old multigravida with previous cesarean develops sudden severe abdominal pain during the labor, followed by cessation of uterine contractions and fetal bradycardia. What is your diagnosis, doctor? It is uterine rupture. Any sudden severe abdominal pain, cessation of the uterine contractions, fetal bradycardia, typically you need to remember the possibility of uterine rupture. A primigravida undergoing assisted vaginal delivery requires a mediolateral episiotomy. At what angle from the midline should the incision ideally be given on a stretched perineum? 60 degrees to the midline. Typically reduces the is the one which need to be given. Now, so you have mediolateral, midline, ideal angle in mediolateral. Why not midline? You need to know the perineal tear risk is more with the midline. In the WHO partogram, once active phase of labor is entered, every 4 hours, we need to assess the labor progress, alert line, action line. And when do you call active phase? The moment the cervical dilatation is more than 4 centimeters, you call as active phase, is what we need to remember. So, in the first trimester, it is the crown rump length which is the most important and accurate measure of the gestational age, is what we need to remember. Now, intrauterine fetal death most commonly is because of an obstructed labor, is an important risk in the given clinical scenario. So, which local anesthetic you will put in the ophthalmic procedures, doc? Proparcaine, 0.5%, whose onset is within 30 to 60 seconds and duration is 5 to 10 minutes. It blocks the voltage-gated sodium channels. Advanced cardiac life support, we administer soda bicarbonate in order to counter the metabolic acidosis, is what we need to remember. Local anesthetics, all, what is their mechanism? It is the blocking of the sodium channel is a mechanism of action. 54-year-old man collapses in the hospital corridor and found to be unresponsive. No carotid pulse, no spontaneous breathing. So we need to do early assessment, CPR, defibrillation, advanced life support, and you need to be very sure. So what are the common reversible 4H and 4Ts? Hypoxia, hypovolemia, hypokalemia, hyperkalemia, hypothermia. Similarly, tension pneumothorax, tamponade, toxins, and thrombosis, the common reversible causes, 4H and 4Ts, you need to remember. So 30 compressions, 2 breaths, rate of 100 to 120 per minute, and depth is 5 to 6 centimeters. These are all favorite questions of the examiner, doctor, for the tomorrow's NEETPG. A 36-year-old man in mechanical ventilation suddenly develops acute respiratory distress. Absent breath sounds, which is a clue to say it is pneumothorax, classically. 22-year-old is being brought. He believes aliens are communicating with him through television signals. Is schizophrenia. Similarly, hearing voices discussing his actions in third person, believing his thoughts are being broadcasted, is schizophrenia. Most characteristic perceptual disturbance which is seen in schizophrenia is auditory hallucination. Now, typically major depressive disorder, it is the deficiency of serotonin, norepinephrine. The two main neurotransmitters make us depressed, doctor, so don't be depressed. A 90-year-old consuming large amounts of food followed by self-induced vomiting, and her BMI is 27 kg, is bulimia nervosa. Normal or overweight is BMI more than 18.5. Fear of gaining weight, recurrent binge eating, and compensatory behavior, they all come under bulimia nervosa. A 26-year-old with painful genital ulcers, tender inguinal lymphadenopathy, multiple soft non-indurated ulcers with ragged margins on the genitalia. What else do you need, doctor? Chancroid, favorite question, repeatedly asked in the NEETPG exam. So you should know chancroid, syphilis, lymphogranuloma, venereum, herpes, dushta chatushtayam, 4 villains of Mahabharata. These 4 STDs, you need to be very sure when you go to the tomorrow's NEETPG exam. Typically, chronic painless ulcer over the neck associated with matted cervical lymph nodes, you need to think of tubercular lymph node is chronic painless ulcer with undermined edges with matted cervical lymph nodes, classical presentation. A 28-year-old presents to the emergency with palpitations, sweating, tremors, and chest tightness. Feeling of impending doom is panic attack. 68-year-old with rising PSA. Typically, where do you do gallium-68 PET CT scan, PSMA? It is prostate cancer. The PSMA ligand binds with the prostate-specific membrane antigen, which is being overexpressed in the prostatic cancer cells, and it will help highly sensitive and highly specific. 7-year-old boy, vesicular rash, dew drops on the rose petal. What else do you need? Chicken pox is what you need to basically remember. 12-year-old with umbilicated white dome-shaped lesions with central umbilication, classical feature of molluscum contagiosum. I leave the picnomic infographic mind map color illustrated imagery of all 200 questions and give you 10 points on each question, 2000 high yield facts. फटाफट टेस्ट करना, डिस्कशन सुनना, बाद में 200 पेजेस का PDF पकड़ना, धनाधन रिविजन करना, बस you are ready. Like that, every Sunday, Thursday, totally 30 full scale granters हमारे साथ पढ़ाई करो. सीट नहीं आए तो मेरा नाम मुरली भरद्वाज नहीं. 28-year-old with Crohn's disease, typically CT imaging after placement of an enteroclysis tube distal to the ligament of Treves. So CT enteroclysis is the best way to investigate Crohn's disease. Then both jaws showing all teeth position and stage of development is called orthopantomogram. FDG glucose is typically a positron emitting radionuclide which is used in PET scan. X-ray shows a bony outgrowth, continuous with the cortex and medullary cavity of the parent bone capped by a cartilage is typical of osteochondroma is what you need to remember. So, doctor, with this we come to the end of today's discussion. So, what I want to tell you is preparation for NEETPG should be a child's play. No anxiety, no tension. देखिए बहुत सारे वीडियो एप्स, घंटे घंटे का वीडियो लेक्चर्स, ऑनलाइन क्लासेस एंड ऑल, ये सब सुन के सीट नहीं मिलता. अपने खोपड़ी में क्या घुस गया, what has entered into our brain, what we are able to visualize. Do we know what examiner typically asks in those 200 MCQs which are served like a buffet to you in the tomorrow's NEETPG exam? Very easy. You take last 12 years of NEETPG question papers, last 12 years of INI-CET question bank. If you look at them, there are around 5,000 NEETPG patterns in all the 19 subjects put together. I give you 20-volume PDF containing the hand-scripted picnomic, infographic, mind map, visual imagery to you of all these 5,000 NEETPG patterns which examiner asks you. Once you get that, for example, topics like renal tubular acidosis, retinal detachment, retinitis pigmentosa, or visual field defects, we don't utna dhyan nahi dete hum MBBS. The same things will come as MCQs in exam, time and time. If you take any question paper, only 20% paper is sudden surprises hota. But 180 questions to sure shot, एक breast carcinoma, एक colon carcinoma, एक prostate carcinoma, एक cervical carcinoma, एक ovarian carcinoma, एक endometrial carcinoma, one contraceptive, question on contraceptives, one on apoptosis, one on glomerulonephritis, one on nephron physiology. Like that, in fingertips you can calculate, doctor. So you should go to the exam with anticipation, attack the examiner. Hardly 200 hours preparation is more than enough for you to become the winner. In the past 26 years, it is a God-given opportunity for me to hold the hand of some of the wonderful people. 5 lakh NEETPG aspirants, PG medical aspirants. NEETPG only 10 साल से NEETPG कहते हैं. इसके पहले it is all PG medical, right? So, right from 1999, when I myself became a topper, first rank, and joined NIMS in general medicine, उस जमाने से मैं NEETPG को देख रहा हूं. It is the same trend that will remain. There will be when you go to Shimla or Ooty, there will be a suicide point, sunrise point, sunset point, eco point, like that. Very constant things exist. Just it's a question of you. Are you prepared for those constant things? For example, what are anti-apoptotic, pro-apoptotic factors? What is backstream, etc.? Are you ready to reflexively answer in exam hall? Levonorgestrel, gestrel, then emergency contraception, vasectomy, tubectomy, what is Pomeroy, what is Maitland, kahan katte hain isme, what is the reversibility? Are you ready before you go to exam? Similarly, how does hyperkalemia ECG look? Hypokalemia ECG look? Where do you see QT prolongation? Where do you see shortening of the QT? What are the different dyslipidemias and what is the ECG? Are you ready? You should be ready with what examiner is going to ask you. And that should come internally into you. You should have a visual memory, not by listening videos. ये coaching better है, वो coaching, कुछ भी. Why? You are a doctor. You yourself is capable of giving coaching, doctor. Let me be very sure, right? Correct notes, your own notes if needed, and knowing the patterns. And 840 topics वो लिस्ट में आपको देता हूं, अगर आपके पास नहीं है तो. एंड एवरी थर्सडे संडे हम मिलेंगे, मॉक टेस्ट का डिस्कशन करेंगे. 30 मॉक टेस्ट, 6000 MCQs खत्म करते ही आपको सीट मिल जाएगा. गुड लक एंड गॉड ब्लेस यू.